Our guest on this episode is an innovative public health leader with expertise in evaluation and social impact strategy. She was a guest on this podcast 5 years ago and returns to share more of her journey with us today. You're listening to the PHEC podcast, episode 348. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. You may not be aware of this, but I lead a public health and epidemiology consulting firm with a strong data team that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we are always humbled and honored to serve. We help our clients communicate their data and health information in plain language to the communities they serve. This type of support builds and strengthens relationships between organizations and the individual community members. Some examples of the support we provide include comprehensive toolkits, fact sheets, custom reports, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific diseases and health-related topics that are most pressing within that community. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website. You can go to drchuntley.com and click on the Consulting tab. We'd be happy to meet with you and explore how we might be able to help support your organization. Links will be provided in the show notes of this episode. Now, on this episode today, my guest is Dr. Sandy-Asari Hogan, who was also our guest back in episode 78. Now, that was 270 weeks ago, back in February of 2019. That was before the pandemic. A lot has changed, right? For all of us. But I encourage you to listen to that episode. Go back to 78, episode number 78, and listen to that one because we shared a lot of information about the Society for Analysis of African American Public Health Issues, or SAFI, on the show notes page for that episode. And it also includes some great information about the organization. Again, we'll provide links to that on the show notes for this episode, just to make all of that really easy for you. Over the years, I've engaged with Dr. Hogan across social media, through leadership meetings within the epidemiology section of the American Public Health Association, in person at conferences, as well as social events. I'm excited to have her return back to the podcast to share more of her journey with us on this episode. Now, let me formally introduce her to you, and then I'll connect our conversation. Dr. Sandy-Asari Hogan is a director at ORS Impact focused on evaluation and social impact strategy. In her role, Dr. Hogan partners with clients engaged in innovative social change to evaluate aspects of their work that are complex and hard to measure, employing the use of culturally responsive, equitable, and innovative evaluation methods. She builds bridges between evaluation, research, and practice. Prior to this role, Dr. Hogan was the Associate Senior Program Evaluator at Booz Allen Hamilton and has worked as an ORS Evaluation Fellow in the CDC National Center for Injury Prevention and Control on the Division of Analysis Research and Practice Integration team. Dr. Hogan has also served as the maternal and child health director for the Dallas and Fort Worth March of Dimes, and worked in the Department of Government Relations at Parkland Health and Hospital Systems in Dallas, Texas. With over a decade of experience in program planning, evaluation, health equity, and policy in both federal and nonprofit sectors, Dr. Hogan believes that our power exists in the community, both as individuals and collectively. She blends her love of community and public health with innovative mixed methods, cross-sector, and system approaches that facilitate strategic social impacts. Dr. Hogan also believes in the power of giving of one's time, talent, and treasure. Recently, she joined the advisory board of Out of Hand Theater, working at the intersection of art, social justice, and civic engagement. She served as the vice president of the Urban League of Greater Atlanta Young Professionals and is the immediate past chair of the American Public Health Association's Intersectional Council Steering Committee. She has served as the past chair of the Public Health Education and Health Promotion section of the American Public Health Association, President Emeritus of the Society for the Analysis of African American Public Health Issues, or SAFI for short, and is a current board member for Black Ladies in Public Health. In addition, Dr. Hogan is a 2021 Black Futures Lab Policy Institute Fellow, a 2019 to 2020 Leader in Equitable Evaluation and Diversity Scholar, a 2020 Leadership Buckhead graduate, a member of the 2021 Class of Outstanding Atlanta. Dr. Hogan is a member of Delta Sigma Theta sorority and the Efik National Association, Incorporated, which is her Nigerian tribal community. Dr. Hogan, a Houston, Texas native, holds a Doctor of Public Health degree with a focus in public health practice and Master of Public Health degree in community health from the University of North Texas Health Science Center, as well as an undergraduate degree in forensic science from Baylor University. Let's connect my conversation with Dr. Hogan right now. Welcome to the podcast, Dr. Sandy-Asari Hogan. This is not your first time. We welcome you back to the podcast. How are you today?
Thank you. I'm great, Dr. Huntley. Thank you so much for the invitation back. I'm glad I did not run you off the first time.
Not at all. Oh, I've enjoyed our chat kind of behind the scenes as we were getting ready to hit the record button. So I'm all geared up. Let's dive in. For people who aren't familiar with who you are, please take a moment and just introduce yourself.
My name is Dr. Sandy-Asari Hogan. I'm a first generation Nigerian American, raised in Texas, currently living in the Metro Atlanta area. I think I've held quite a few different roles in my life and currently consider myself to be a creative, a budding public health futurist, an evaluator, and social impact strategist. And I currently serve as a director at ORS Impact, which is a social impact evaluation and strategy consulting firm based in Seattle while I'm based in Atlanta. But over time, I think my role and how I see work has definitely changed over time. But this is kind of like where I find myself present day. Very much have a heart for community and service and really just trying to take a vision of what the future could be and helping people make that vision a possibility in their work and in the way that they see and bring light into the world. So yeah, that's who I am and where I am today.
That is wonderful. Of course, we're going to dive into that a little bit because I love to roll back a little bit and discuss the journey, just kind of see how you got from where you started and how you got to where you are now. And we'll link to the previous episode. You were episode 78. That was a long time ago, considering.
Oh, my goodness.
That was a long time ago. We're at 348. So, I had to do the math here. 270 weeks later, we are here again. But let's kind of talk about one of my favorite questions. When did you first learn about or become interested in public health?
Yeah, that reminds me of when did I first fall in love with hip hop? It's interesting. public health had always been something that was in the back of my mind for whatever reason, but I don't know that I knew what to call it. So early on, I've always just kind of had a heart for service and wanted to really help people in the area of health. And so when I went into undergrad, interesting enough, I thought I was going to be a forensic pathologist and work with dead people, and quickly found that I think working with the living was more my speed. And so going through that and just kind of like learning myself, even post undergrad, I wasn't quite sure, what I was going to do. And I just happened to kind of like happen upon public health. I thought I wanted to also open up a clinic somewhere and like provide healthcare services to people. But when I entered into public health study, I quickly realized that public health is much more than the delivery of care, right? Like it encompasses all aspects of who we are, who we interact with, where we work, where we live, where we play. And I found that to be not only fascinating, but it helped me to really understand that everybody has a part to play in public health. I would say that I learned early on, probably in undergrad, that was kind of what I wanted to do. I just didn't know what the name was until I actually entered into grad school.
Yeah, that's interesting. I think that's pretty common in terms of a lot of us kind of found our way into public health. It wasn't necessarily the intention, or, we had this feeling, but we didn't know that there was a thing. It was a thing. We didn't have the phrase or the words for it. I think that's interesting to hear you describe that. Now, is there a particular population or a condition or a specific type of public health problem that you're really passionate about now?
Yeah, I think I've always been passionate about working with marginalized populations, particularly Black communities. And a lot of like the volunteer work that I did when I was living in the Dallas-Fort Worth area was around community and the community's understanding of like health and the impact of health on community, but also maternal and child health. Those two populations and the intersections of the two, I think, have always been really important to me. And that's kind of like where I found myself. Even my first job out of undergrad was with the March of Dimes, and I, was having an opportunity to have some really targeted and pointed conversations about what is and what is not happening when it comes to infant mortality and maternal mortality, the good, the bad, and the ugly, and just had the opportunity to really partner and have some important discussions with folks who are actually doing the work at the ground level. And my heart is still there, though I don't necessarily work directly in public health in the same way. But that's definitely where my heart is, and the populations that I, choose to kind of like for my expertise and utilize my opportunity for service.
Right. Yeah. I definitely understand. And I think it's common for us too we're all sort of multi-passionate in public health. So some multiple areas that we are really near and dear. And there's so much work to be done. So there's sometimes opportunities to have those interests overlap, but there's so many ways to serve and so many opportunities right now, especially. Tell us a bit more about what you do now. Like, what is your role at ORS? And just tell us a little bit more about that.
Yeah. So ORS is an interesting entity. I think oftentimes when we think about like consulting, we think of, maybe just like very buttoned up consulting firms with very kind of like these strict parameters. But ORS Impact is really great in the sense that we really focus on being learning partners with many of our clients. We do a lot of work that is centered on building equity into some really challenging philanthropic spaces often. But ultimately, we are learning, we're an evaluation partner, and we help people really get to the crux of what it is that they're actually doing. So in my work, I've had the opportunity to work with, various clients that do various things, and many of which who are working directly in public health, either as funders or as actual programmatic partners, and help them to get clear on what their actual strategy is. I think oftentimes, people will go into things, they'll be well-intentioned about the work that they want to do, but when you ask them what they're actually doing, what they said that they're doing via their mission and what they're actually doing in practice are two very different things or are not aligned in some ways. And so we help them to get alignment and then really interrogate where the equity gaps are in the work that they're doing. If you're saying that you're doing equity work, how are you doing that? And that can come through various lenses, right? In various ways. It could come through the way that you offer grants, right? It could be the way in which you are asking folks to engage with data. It could be the people that you engage with who have a seat at the table. Are they even present? Are those voices present, et cetera? So there's just various ways that we are able to work with our different clients and partners in that way. And really we just evaluate things that seem really hard to evaluate. And oftentimes they're not the traditional programmatic evaluations that you will see. We do lean very much into theories of change and making sense of outcomes based on theories of change so that people can get to an actual theory of actions.
Yeah. Well, I definitely understand that too, because, I have a small consulting firm and we do focus on serving large nonprofits, especially those that are serving BIPOC communities. So supporting these communities through supporting the organizations, that they are directly connected to. And it's really easy to veer off a bit from the mission and the intent. So it's nice to have that accountability and have, someone overlooking it. It's also, there's a lot of challenges when you can have the heart and want to be more equitable and representative and miss that. So without some really strong support in the back end, it's difficult to accomplish that without that strong evaluator. I think evaluators and epidemiologists are natural partners.
Yeah.
Or should be. I push for that all the time. But it's important to have that kind of eye level on programs early on and the intention and, again, that accountability. So I like what you're doing.
Thanks. I don't hate it.
Yeah. Yeah. So let's shift a little bit into what I like to call connecting the dots. And I like this for, not like we're taking textbook answers or responses, but again, keeping it conversational and just helping people to naturally see where they may be meeting the gaps or see how creatively or differently we can be meeting gaps. So for you, how does the understanding of public health, and I know this goes back to, you've always had this interest and it's kind of been intertwined over the years for you, but how does the understanding of public health help you serve your clients in a way that you can support greater impact, have greater impact?
It's interesting. Like in my classes with students, I often try to drive home the fact that at its core, right, public health is about social justice. And I think that in what I'm doing and the intersection between kind of like some of these philanthropic spaces and these other nonprofit entities in public health, they are often attempting to address public health issues from their particular perspective. And I think with public health, the goal really is to really take a systems approach to tackling really complicated problems that often are made to appear to be very simplistic, but it's not, because every aspect of our life in public health, or every aspect of our life, is impacted by and impacts public health in some way. And so it's important for me to bring a public health lens to the work that we do, in the sense that helping folks to understand that they have a unique contribution to addressing the overall health and well-being of the communities they serve. And it could be through providing grants. It could be through the types of programs that they are delivering, but making sure that people are in community and in communication and in collaboration with one another, I think is the important piece of that public health part. And then there's components of public health that inform decision making, whether that be data, whether that be this overall understanding of culture and context. All of those things come into play. And I think, though it may not feel or seem explicit, those things are really important in the types of discussions that we have, especially when we're trying to evaluate quote unquote impact, whether that be in the immediate present or long term. So public health it's something that is intertwined in everything that we're doing. What I don't often see, though, is I think we're hearing more and more about that now. But, in episode 78, I think the discussion was still very much kind of like pulling teeth, trying to get people to understand that public health has a place in everything that we are doing. Even if you don't feel or believe that public health, what you're doing is directly related to public health, there is a relationship. And so I think we're getting to a place where we're having those discussions about the impact of what people are doing, their unique contribution, and how that is impacting our communities all over.
Yeah, that's really good. I really appreciate that. And yes, as you were saying that, it hit me. Yes, our conversation back in episode 78 was before the pandemic.
Yeah.
And yeah, so that is a very interesting perspective, because now we have a whole new lens that we filter through, based on these experiences. So in that same kind of lens, how does the understanding of epidemiology help you better serve your clients? And I understand this question. Some people get a little nervous thinking, well, I'm not an epidemiologist, or, because I'm not looking for textbook answers or anything when I ask this question. I really want this applied kind of reflection, because I want us to be more comfortable with talking about whatever we understand of epidemiology, so that people can be, especially as public health folks, to be able to have a more comfortable conversation and positioning around epidemiology. So just what are your thoughts, around that, the understanding of epidemiology? How has it helped you serve your clients?
Yeah, I mean, some of my best mentors are epidemiologists. I, by no stretch of the imagination, epidemiologist, but if I could go back and do it again, I might have been a social epidemiologist. But, if we're talking about disease or just any other type of kind of like health factor, understanding this idea of like incidence, distribution, etc., is really important. Like, we want to understand sometimes the origin of things, right? And the data helps us to understand kind of like where we are present day, where we've been, and oftentimes can help us to kind of project and see where we're going. And I think that epidemiology and the work that I do is important, because data is an important tool to inform decision making. It helps us to understand like where the real issues are, and we can use that then to pull into that data an understanding of context. So data without context really they can just be numbers, but really understanding why those numbers exist, why certain disparities or equity gaps persist, are important. And without epidemiology, right, we can't often make those linkages in a way that we can track those things over time. And so I think epidemiology is critical in that sense. And while people may not say that, I'm explicitly using like an epidemiologist, the work of an epidemiologist is going to be pulled into the work that you do, whether it's the data to support why you are focusing on a particular health area, to understanding why it's important, for instance, to understand the distribution of COVID, if you will, if you want to get into that, right? So just that data, those numbers are really important to make informed decisions, but also to give color contextually, right? So we understand why the numbers are what they are. So epidemiology is important. I mean, without it, there's just something that we lack in being able to make critical decisions.
Right. Yeah. So now I'm curious. You said that if you could do it all over again, you might be a social epidemiologist. Now I'm curious, why a social epidemiologist?
I took a class in grad school on social epidemiology, and I think it married like this idea of the numbers, but an understanding of what those numbers mean, and utilizing that as a way to like really create solutions in community with other people, so that we don't see that same data year in and year out. I think it really helped me to like think about like the contextual aspect of the data. And it just opened up my eyes to what epidemiology is, apart from just some of the numbers and looking at incidents and these distributions. But it gave kind of like this community face to these numbers. And I just really appreciated that. And there are various professors that I had who were working in the kind of like social epidemiology space. And I was just like, maybe if I had found that earlier, maybe I would have chosen like, a different path. But I just could see myself in the things that are important to me, and using data to inform those things and also make changes. I thought felt like it would have made sense at that time. I'm not going back to school though, but
I definitely understand. Yeah, that's great. Thank you. Thank you for going a little deeper on that with me. I'm sure someone's listening going, I'm glad she asked that question. But no, that's really good. I completely understand what you're saying on that. All right, this has been great. So let's kind of wrap up because I really appreciate you being generous with your time and sharing with us so much about your journey and the updates, over the last 270 weeks since our last. Now, that's not the last time I talked to you, but that's our last episode here.
Yeah, I'm going to put that on a shirt.
Yeah, that's right. So, final question for you. For someone listening who may also be interested in similar type of work, do you have a bit of advice or a tip that you could share with our listeners?
Yeah, I would say that don't be too stringent on what you think that you want to do or who you want to be in this space. Just in life in general, we go through cycles, and really our professional life is about evolution. And even however many years after I've graduated, I'm continuing to evolve and learn new things about myself and how to apply what I have learned in very different ways. And I'll use an example of, I talk about being a creative, and I feel like public health is a place for me to be creative in a very different way. But I've also been able to use my public health understanding in political campaigns that I've been able to support, and, helping them to talk through things that are important to me from a public health perspective and applying that in a political space and why these things are important. So just recognize that where you are today is not where you're going to be tomorrow or even 5 years from now, and offer yourself some grace. I would say to continually build relationships with people who are doing things that, yes, are similar, but also that are different. And I encourage people to find the intersection between what's important to you and what's important to them, and where you all actually collide and meet in the middle. And I think that is really the sweet spot, because we all have a level of contribution and responsibility to our communities. And we can only do that in community with one another, and not in silos and not apart from one another. So I think those are the biggest lessons that I've learned, that community is everywhere, but we have to be intentional about building that community and bringing the best of us to that in order for us to really realize true change and true equity.
Oh, that's really nice. Thank you for that. That's well said. I appreciate that. This has been so much fun. I appreciate your time, attention, sharing so much about your journey and insights and all of that with our audience. And the time to catch up has been fun too. I always enjoy being able to catch up with you, especially bumping into you at conferences is always nice.
Yes, absolutely.
So let's keep in touch and continue to do the great work. And I'm going to let everyone know how to connect with you, which I highly recommend. We'll share your LinkedIn contact details on our show notes page, and I'll give them all those details in a moment. But for right now, I just want to say thank you for being here, and I appreciate you.
Thank you so much, Dr. Huntley, for inviting me back, and congratulations on such a great platform that continues to grow. I, again, deeply honored to be able to be a part of your community and just be able to continue to support them. So just deeply honored and just very humbled and excited about things that you're currently doing, and I know the things that you'll do in the future. So thank you so much.
I really hope you enjoyed that conversation as much as we did. Dr. Hogan is a powerful leader and a creative public health professional. I encourage you to connect with her, learn more about the work that she's doing. You can find the links to connect with her on the show notes page for this episode, along with all of the links that I mentioned to you at the very beginning of the episode. So the show notes page for this episode, which is 348, can be found at phecpodcast.com. And once you're there, just navigate to episode 348 to find its show notes. One more thing before we go. Please take a moment and share this episode with a friend. I'm sure you know a few people who would be interested in hearing this conversation. If you're listening right now in one of the podcast apps, then you can easily share this episode through a text or share it directly to social media. At the bottom of our show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.